We're going to go ahead and call this meeting to order. It is 11:33, and I welcome you to Laredo Webb County Drug and Alcohol Commission meeting for Wednesday, March 12th. I'm going to go ahead and go around and ask everyone to mention their name and their agency that they represent so that we can go ahead and have it for attendance purposes. My name is Colleen Rodriguez, and I represent Laredo Crime Stoppers. Present.
I'm Jesse Hernandez, Center Therapist Practice, La Familia Consulting Counseling Services.
Earl Medina, Rivera, State Haven, President.
Yvette Ortiz, West Chair.
Master Iram Tellez with Grace Center Casa Rescate.
Armando Duarte, West Care. I'm Jacob Rios, I'm with West Care and Protecadas.
Pamela Espinosa from the Frontera Program Estimate.
Jacob Vasquez, Program Coordinator, Frontera and Sanidad of
Mónica Bautista Rebecca.
Rosa Espinosa, Liliana González with Keller. El actor de Keller.
Esmeralda Rendon, AMA, Recovery Peer Specialist.
Alazar Badass, Laredo Public Health.
Erica Lopez, Laredo Public Health. Ana Moreno, Laredo Public Health.
Catalina Aguero, Substance Abuse Program with Puerto Region.
Griselda Carrillo, Program Director of SCAN.
Teresa Cabello, Program Director with SCAN.
Francisco Adame, Program Director.
Marina Medina, Mike Purpose, and District 8. Sorry, I'm not speaking that well too. So I'm over here.
Angie Flores, Laredo Public Health.
Thank you very much. I almost missed you on this side because I was like, wait. So we're gonna go ahead and make sure that you all have signed in, if you all haven't signed in. Otherwise, Earl will take down your attendance, but please make sure that you sign in. And then just to confirm, everybody has received either an email or is part of the WhatsApp group, correct? If you are not, then get with Earl so that he can go ahead and add you. Because we are going to poll in the future for the attendance of the meetings. I do want to say thank you to SCAN and to every agency that is represented here for being here. We definitely appreciate you all. Ms. Angie, we don't have any public comments, correct? So we don't have any public comments. I do want to ask if, for the purpose that we're here, is there anybody that would like to give the invocation for the meeting? Mr. Days.
We would please bow our heads for God. Dear Heavenly Father, we give you thanks for this day that you allow us to be here, come together, Father God, as a community, Father God. And I thank you for the desire to do better for our community and help our community. Bless each and every representative family in this place, Father God, and we put this meeting in your hands in Jesus' name. Amen.
Amen.
Thank you so much for that. We're going to go ahead and advise that unfortunately we were unable to meet quorum. We do have some committee member positions that are available. So I do ask any of the stakeholders if you are willing to reach out to, I think we have a vacancy.
District 4 and 6.
District 4 and 6. If you'd want to reach out to your city council members and advise them of your interest in participating in the commission and committee to being here for the meetings, we would greatly appreciate it. We don't have, unfortunately, quorum. There's a lot of people that are under the weather, including Marina, who's over there. I'm feeling a little exhausted, but we're here. And then we do have 3 commission members that right before the meeting advised that they were going to be in attendance. I do want to say thank you to Earl and Marina for providing lunch at the very last minute. We ask that if you are interested in providing lunch for any of the future meetings to get with Ms. Angie so that you can sign up your agency, and we would appreciate it. So without further delay, I know that we are in a lunchtime and we're going to go ahead and crunch this meeting very quickly. We do want to give everybody the opportunity to be able to still advise us of what your agency is doing. However, we will not discuss any of the information that we wanted to bring up under possible action, but any reports are definitely kindly appreciated. So I know that Dr. Cerda is representing Dr. Chamberlain and he's outside. However, do you want to?
I can briefly discuss until he comes in. I know last time you guys had asked, we have mentioned the vending machines that we do have at Laredo Public Health. These vending machines do cover an array of items. You guys had asked for a breakdown of more or less like what are the most common objects that are being taken, so this was, for January and February, I did highlight Narcan. It is still one of our top items that's being taken, but for the most part, it's mostly like, for January it was antibiotic cream, flu test, body lotions, condoms, hairbrush, tissues, and Narcan. And then for February, it was dental care packages, condoms, hairbrushes, body lotions, shampoo caps, first aid kits, Lysol wipes, antibiotic creams, and Narcan. So these are, again, they change and they vary month by month, but for the most part, Narcan is always in the cabinets, or in the vending machines, I'm sorry. This isn't reflective of all the Narcan that's being distributed from the cabinets that we have at some of our recreation centers. These are just for the vending machines. In February, we also opened a vending machine in Cigarroa Recreation Center and Baskin. I wasn't able to get the data for Baskin, but these are some of the items that were distributed. So from Cigarroa was 563 items. 27 Narcans were distributed within a month, which I think is a pretty good number. Again, dental care packages was very high up there, like it was in our Laredo Public Health vending machine. We have deodorant, insect repellent, skin and hair cleanser, condoms, first aid kits, which for the most part, condoms and first aid kits and Narcan stay pretty relevant top there. We also do COVID exams, we do flu tests, pregnancy tests, so all of these items are free of charge, and for anybody to pretty much just come and get anything that they might need. And like I mentioned, we also have one recently in Baskin Recreation Center in February, but I'll go ahead and provide you with the data for the following month. I think he's still talking up there. For data, we kept it very brief. It was 20 overdose calls in 2025, which would be January and February. Here it was broken down. This is also found in our GIS map. If you scroll over here, it should pop up somewhere. And the majority of the calls, 2 of them were for alcohol, 4 for cocaine, and there's not the 1 fentanyl, gummies, pills, unknown substance, and Xanax. So this is simply just the overdose calls that they received. So from those 20 overdose calls, 5 calls did result in death by overdose. So here are numbers so far for 2025. January, we did have 1 overdose death, which was relatively low compared to last year. And in February, our numbers unfortunately did increase to 4 for a total of 5 up to date. Do you want to jump in, Dr. And that's about it for my part.
Yes, thank you. Erika was doing a review, and we were reviewing the cases related to drug overdoses compared with last year. By February last year, we have 8 total deaths, and we have 4 this year. So it's an improvement. However, it's too early in the year to really analyze the data. But at least we have 2 good months. If we can say so, it's just a tragedy, right? One day is a tragedy, but I think we're going the right path.
I do have comments. It's interesting. I did my evaluations for drug court and the veterans court. One of the numbers that dropped dramatically in the drug court, from all the evaluations I've done since 2009, was the number of opiate users. I mean, we typically hit about 25% annually, and we went down to single digits. And I was very surprised. I don't know if it's a combination of all the efforts that are going in the community with Narcan, with a detox program opening, but a lot of these people aren't getting involved in the criminal justice system, and that's good. But that was the biggest drop I've ever seen with opiates, because we used to have 25% all the time. That was our number, but we didn't get it. We didn't get it this last year. So I'm interested to see what the next 6 months bring about. And certainly last year, when we were getting a lot of people testing positive for cocaine, but with fentanyl in it, they didn't even know that was there. So all of that also. So I think that has a lot to do with the people around here. I just want to mention that because I wasn't here in January.
Thank you. And I think we'll probably, I don't know if it's the case or not, maybe Chief Gonzalez can let us know more about it, but maybe the effort on having better control of the borders, if it's that related, I'm not sure, but these are good news.
Yeah.
whatever the case is.
So it's something's going on positively.
Right, this is, and everybody here at the table has contributed to this. It's a lot of people wanna know about that silver bullet that, you know, corrects this social problem, but it's been a series of things, from awareness campaigns to, treatment efforts. We're more aware what the problem is, the treatment is shifted to that focus. Apologize for that. The treatment, of course, and then we move on to the enforcement. We've also changed the way, and I spoke about it last time, the way we approach them. We no longer treat them as just a simple death investigation. We treat more like a homicide because a lot of these consumers are unsuspected consumers of the drug, but they don't know it's there. Their bodies are not used to it, and that's what sometimes causes a problem. So we're treating more homicide investigations. We charge people with federal charges for those homicides or contributing to that death. That's been a disruptor. The borders, how we're closing up the borders, being more restrictive of what comes in, that also helps. And the big one, the big one that contributes to reduction of deaths in our society is obviously Narcan. Narcan, and the readily availability of it through programs that a lot of you have been involved in having not only have them accessible throughout different buildings, but also directly to people, training the outreach of the people that need it, going to them rather than them waiting for them to come to us. I know that when we get the calls, both fire department and Lower PD are prepared to deploy Narcan. We're usually the first ones to see a person going through that crisis and situations that would have resulted in death. We see that a good majority of them are now people just bouncing back or not going through that episode of going through a death. And it's amazing what this drug can do, that in the moment somebody that's in the brink of losing their life just comes to, and to the point that they become uncooperative and walk away.
Mm-hmm.
But at least we didn't lose someone in the community.
I've seen actually, I worked with a young kid one time, we took him to the hospital, we were giving Narcan, and he got up and he just ran away. But I just wanna remind people that, and I know there's a number of people here that have supervised, and some of you all work in agencies or nonprofits. I always wanna remind you that there's always a co-create psychiatric substance disorder, there's mental illness involved. I have never in 37 years of working in this field met anyone that just had a substance use disorder alone. And we, you know, when I was at Border, when I was Laredo State Center, when I was at SCAN, when I was a consultant at Pillar, we always focused on the mental health issues. And you all, you know, I'm 67, you guys are young guys. You have to go out and continue focusing on mental health. I know it's harder when people are using substances. We gotta make sure that they're clean and they're not using, but we always have to look at the mental health. Make sure you send them to places, make sure we get the psychiatric help. By the way, we do have a psychiatrist here in town again after Olmedo passed away. And Dr. Rodriguez, who was in my office, is no longer taking clients. He's getting ready to kind of back off. But we do have one a psychiatrist, and I'm very happy, Dr. Nick Lumpian Jr. I've been working with him for about 1.5 years when he was Gateway, but he just opened up his practice in January and is taking over Olmedo's cases. So please remember that if you're working with someone that has issues, you know, we can get them to a psychiatrist. I was working with someone that had a bipolar disorder, but it was also a cocaine addict. But if you can get him on something like Seroquel so he can sleep, and then you manage a little bit of his psychosis, his manic behavior, then, I'm about to get them into treatment, so, the faster you get them off that psychosis, the better case you have, so please remember that, and it's just not substance use alone, because I came in a day where it was just substance use and not the mental health, so, thank you.
Thank you, Jesse. Is there any other information for the City of Laredo's public health report, please?
No, so far it's what we put on the consent.
Thank you very much. For the record, we are taking attendance. Make sure that whenever you have an opportunity to please sign in. And for those of you who came in later, could you please introduce yourselves?
So Ricardo Gonzalez, Assistant Chief of our Police Department.
Edgar Martinez, EMS Operations Captain. Adrian Esparza, EMS Operations District Chief.
Luis Seada, Preventive Care Service Administrator, Laredo Pública.
Adriana Morales, Harm Reduction Specialist.
Thank you very much. As we continue, do we have a report from Dr. Viviana Martinez or from the detox facility? We're gonna go ahead and continue and table the information for discussion and possible action. We're gonna give everybody the opportunity to give us stakeholder updates or information. So we're gonna go around the table to see if anybody would like to share briefly anything that is going on with your agency or anything that you'd like to share with all the members of this commission. Earl, Jesse?
I don't have any.
No, I already made my comments.
Thank you.
We work with West Care, Texas. We're a nonprofit organization, drug-free community. Right now, we're working with schools in the South, LBJ, United South. So we've had a total of 835 students that we're working with. What we do is we bring in the knowledge, stay away from drugs, alcohol, and we give them basic life skills. And we also introduce the agencies here in Laredo. We tell them that they have someone to go to. We introduce public allies as well, and we work with all of you guys with Bethany House, Pillar, Alma. So we recommend, but we want the kids to know that there's help for them as well, not just the adults but the teens that they're there before. So that's our goal. Thank you.
Thank you very much. Going around the table. Anything that you'd like to share?
Yeah, for SCAN, we're having a stakeholders meeting, next Thursday, March 20th, from 10 to I think 11:30. I know we send the invites, Nancy Sandoval, one of the program directors, send the invites, but if anybody's more than welcome to join us. We're gonna have, my two programs from Terance, the LP, and Frank Adams' program, the MAP program, and DWI. So we have that event, stakeholders meeting next Thursday, and if anybody would like to join us or any updates or anything like that, you are more welcome to come. It's gonna be at the Hendricks office, 1702 Hendricks Avenue at 10 a.m. Yeah, that's pretty much it.
Thank you.
Sir, your name is?
Jacob Vasquez.
I do want to share that as part of the Homeless Coalition and Bethany House, we, along with our partners, I know Scan, Pillar, and many others that are present here, we conduct a point in time count in January. So nationally, there is a data assigned so that we can conduct the count. It's not really a census of the homeless population, but it does give us like a snapshot of the characteristics of, or the trends of the homeless population in the community. I just got that report, so I'll be sharing that with, and maybe Angie can help me distribute with the group, but just hopefully you'll be getting that very soon. That is one thing. Another question that I wanted to see, maybe this can be brought up in an agenda in a future meeting, a concern that we see or a gap that we see in the continuum of care when it comes to detox is I think that, for example, here, Rosa does a very good job with the outreach, really working very closely together with Roots and enrolling people. We've had very successful cases where we see how good it does to the patient, right? We see how the person comes in and how they come out, and it's like really transformative those 14 days or even sometimes less than that. But our concern is that there's really not a good continuation. So a person that comes back to Bethany House is very likely to not be successful in that, in a longer recovery, right? And we see maybe within a week that all the work done has served no purpose. So hopefully that can be a longer, a deeper communication and conversation about how we can really work together, whatever it is that we can do as Bethany House to connect them to, whether it's residential or whatever it is that can increase the success of a longer term recovery, right? This is not our area of expertise, and we're open to the feedback of anyone, but hopefully this can be just a conversation that we can have at a later point.
Well, thank you very much, because I was going to say that we've been trying to meet to discuss the aftercare of somebody who goes into a detox facility. I think to further that conversation can probably be Jesse, because it's been since the moment that the wheels got turning with the detox facility, we automatically thought of the aftercare. What's going to happen after they go through the detox facility, because we don't want there to be that gap where all of it goes in vain, per se. And so, Jesse, would you like to share?
I guess, first of all, my first question is, does Border Region still provide services for the homeless over there at your place?
Yes, Fort Region, Pillars, Scan.
Okay, good, because they do have a co-occurring disorder outpatient treatment program. So that's one, but the sad thing is that we lost so many beds, even with what Scan has. I don't know what Scan has now, as far as the number of beds, maybe 20?
Right, so we, at the Mills Residential, we have about, I believe, 18 beds, 18, and at the female station, 12.
Okay, so when back in the 80s and in the 90s, going into 2000, when AMA lost the grant for residential treatment, we had close to 40 beds. As a matter of fact, when I was deputy director of treatment at SCAN, we had 42 beds for adolescents. So we've lost a lot of services. And the thing is that the reason why it's so difficult, we've talked about residential treatment, aftercare. The problem is that you can't find a federal grant that will fund that. There's no really Samson grant that will fund that. We don't even know what's going to happen to our federal grants right now. And the money that's been dedicated here in our region, I'm sure SCAN has applied for the bulk of it, but it's spread out so thin, and it's unfortunate that we've lost beds, so we have to figure out, just like we got the detox, there's going to have to be some buy-in from the community, because all, and mine are private pay clients, right, that I see, but I refer all of them out of town. There's really no place. Now in the drug court, we just send everybody to SCAN, right? We have short-term treatment SCAN, we have long-term treatment out of town. But we've got this problem where, unfortunately, unless you do some type of day treatment, and I know that one time I was working with you all. Was that? Yeah, I was working with that here many years ago to do a day treatment program, and because they did have a shelter, and we wanted to do day treatment there, and that was the whole concept. But we're really short, and I don't know what to do. There has to be buy-in in the community because we don't have it, and certainly the whole population is going to get worse.
And I think it's very important, and I appreciate, again, I can't reiterate this information enough, but I appreciate you all coming in because numbers are very important because it shows the success and then obviously what isn't working. And so if you have those numbers of the people that are going back to Bethany House after the detox facility and stumble across that problem again, then we definitely need to address it and see if any of the agencies are better equipped to be able to look for either a grant or to see if there's a collaboration. I know at one point there was a grant that was available, but again, it has to come through one of the stakeholder agencies. But we'll take that into consideration. We'll put it on the agenda for the next time so that we can discuss a little bit further. Again, these numbers are very important. Thank you for your update.
And I think what's happening right now is that, I'm sorry, I didn't interrupt, but I think we're doing a really good job collaborating, like Bethany, Pillar, Scan, and Water Region, because we're meeting on a monthly basis. But I think what Monica, and please correct me if I'm wrong, we're trying to have like a warm handoff with either each entity or from the detox end.
Of course.
Because I think that's where we're kind of like, you know, from either detox or from Bethany, we're trying our best as collaborating to say like, okay, if the homeless goes to Bethany, okay, she's trying to weave up, okay, suitable for Pillar, suitable for Scan, or Region, or are they coming from detox to Bethany? And we're trying to like really kind of knit and grit, like, okay, the warm handoff is going to be very crucial and very important on the success of the client.
Yeah.
I think that's
Agreed.
what we're kind of like, we're trying our best to like
Yeah, no,
collaborate.
thank you.
No, I know that you all do a great job. I'm just curious because has anyone seen a huge uptick in immigrants? I'm in private practice, and I used to get about 2 immigrants a month from lawyers, you know, to work with them. In a week and a half in February, I got 15. I work on 3, and then I get 3 more. My waiting list for immigrants is huge. I have my regular population clientele, and then this that just kind of grew. And also very severe issues because they were all trafficked and victims against women, visa T people. Do you all see a lot of that? I know that some of you, because of your funding, you don't get to, but I see a lot of that just in private practice. But has anyone seen that?
Yes, I don't know if this is related or not, because I know it's patients that request services from your practice, right? But at the immunization department, we saw an increase during January and February of migrants fixing their papers or their status, coming to request vaccines because those are more the mandatory vaccination rules that the federal government imposes on migrants. And yes, we saw that here, not necessarily in other services, for immunizations, yes.
No, la realidad es que yo tengo clientes que son inmigrantes que son clientes de ustedes y han ido con Juan para psychotherapy. They've gone and they've gone to health services here, and I see these people and it's very, very difficult. And so I got this huge surge, and I wish I could split myself in different places because they pay their lawyers a big amount to do this work. And then the lawyer said, okay, well, you have to do a psychological assessment. Okay, well, let me work on it. And that takes me just 4 hours alone, but then the report, but I feel for them because they want it immediately. And it's hard. And I saw that surge, and I guess you're saying the same thing. Because
yes.
There are those clients that I'm having are the same clients, and I feel for them because they have up with a lot of money to pay their attorneys, and unfortunately, as much as I can keep my rates down, even me, it's a lot of money.
I think that they changed on administration at the federal level.
Oh, yeah.
They were kind of pressure or more, they have more urgency to fix their status. And so that's why they're coming here.
I think when you work with immigrants, you realize the suffering and humanity that, I see some people, I saw someone on Monday, it took me 6 hours to do her assessment, and it was trauma after trauma after trauma from the time that she was a child. And all of them, I can tell you, all their diagnoses, PTSD as a driver, double depression, general anxiety, panic disorder. Some of them do have personality disorder, some of them don't. But it's a very difficult population to deal with, and how do we serve them? Because they do live here, they work here, they pay rent, and it is tragic. Yes.
I wanted to go back to Ms. Monica's gap. I think a lot of the times it's like a revolving door, right, where the client may keep coming back and keep coming back. I think it's important to note that the services that we offer. I guess most of the services that are offered are voluntary, and so that becomes a problem within itself, just because they are not mandated or they're not obligated to get service, and so that's when you see that revolving door happen. I think working with probation, in my experience, I'm not on probation, right, but in my experience, when they're on probation, they're more compliant with services because they have a condition. I feel that what Jacob was saying was that we need more of an integrated approach where we work together to make sure that the client gets the services that they need, and that's the best thing we can do.
Yeah, to have
I think what we'll do is for the next, like I said, for the next meeting, we'll bring it up on the agenda. We'll talk to Laredo Public Health and the detox facility to see what they're doing afterwards, and then see if we can come up with a solution. What the other idea is that maybe next time for the agenda, so that we have a little bit more discussion and be respectful of everybody's time, is that we'll do like a one sheet of what our strengths in our agencies are and what we feel our gap in our agency is, and be, you know, if it's money, if it's, you know, a program service or whatever the case may be, that way we can kind of jot it down and see where we can start moving forward with the meetings that we have, and with everybody here collaborating and saying, well, I can do this, or I can't do this, but I can do this, or that we're able to take these clients into our agency. A lot of good conversation, so we definitely appreciate it, and we have it all noted down. Moving forward, do we have anybody else that would like to share stakeholder updates?
Oh, I just want to remind everyone that at Pillar we offer different services, right, that could help the individuals in both the mental health and physical health with our medical clinic. But if you have any more questions, you can always give us a call or check our website. But we do have an event coming up on May 4th, a bowl-a-thon, to raise awareness of our mental health services and that gap that we all know and know well. And so if you want to participate, I'll go ahead and send the information to the group, and that way y'all could sign up if you're interested.
Thank you.
I just have a thought. Kudos to SCAN, because we were talking about a soft landing, you're talking about trade services. I do remember when SCAN started providing wraparound services through the KV Foundation, and they've continued that over the years. You know, this is going back to the 90s. So I'm glad to see that you're still doing that, because we all have to work together. We have to have these wraparound teams. If not, how are we gonna help the homeless?
Exactly.
How are we gonna help the immigrants? And so I appreciate all the work that you all are doing. I mean, you guys are on the front line.
No, and all credit goes to, I mean, we're a product of Mr. Manrique, Mr. Flores, Ms. Perez. We're all a product of them.
You know, I hired Enrique. And I remember when our office was only 4 people. It was only Luis, me, Raquel.
Are you?
I
You're
wasn't that
Oh, you're the famous Jesse that they talk about.
I'm the famous Jesse. I hope I'm not the infamous
No,
Jesse.
this will be our first and last interaction, so. I'll leave it at that. No, I'm kidding.
Well.
Good things.
Okay, yeah.
Keep a note that everything is on record.
I still talk to you. Luis was a groomsman at my wedding.
Do we have a status update on AMA, please?
Tenemos ahorita 20 capacity for 20 more. Ahorita ya estoy at the recovery coach, so I'm doing the group sessions, support sessions. Y going back to lo que decía Mónica, the only thing that we have here in Laredo to support that es serenidad. Porque después del detox te puedes ir para serenidad, but the thing is que no todos se quieren ir. So that's the difference. We need to have another option for that. Porque es ahí donde se hace el relapse. Cuando la gente sale del detox, vuelve a la misma área, la misma zona, no conocen a nadie más, no tienen familiares, y es allí donde hay que atajar el problema. So, entonces, es como yo me imagino considerarlo sea algo para poder, como otra serenidad, pero en otra parte, o para que la persona tenga de perdido 2 opciones. Ok, no te quieres mover para serenidad, ok, tienes esta opción. De ahí agarrarlos, o sea, y hacerles plan, o sea, ¿qué es tu plan? O sea, después de aquí, ¿qué quieres hacer? Put them to work, hay que mandarlos a trabajar, hay que mantenerlos activos para que ellos empiecen a integrate back into the society y puedan funcionar de nuevo.
Pastor Pérez, y yo lo he visitado, tiene un programa fabuloso that will complement, you know, what Serenidad does. ¿Cuántos tienen? Como unos 30, ¿verdad?
Yeah, right now, the capacity was 21 that we had. Right now, we've lowered our number, because of beds, and we're moving from our address. So that's why I didn't mention anything right now, because we're also an option here in Laredo, and I work with,
Yeah.
with SCAN, with Pillar, with, Bethany House, and, even, Hama, that, they refer people to us, but since, we're faith-based, and also, the thing is, like to say, the numbers matter a lot, because you're always gonna have that person that's gonna relapse, and we get the numbers of how many come and go, because a lot of our clients, like, they're the same people that we've been working with, and we've been helping, and I know that if we continue doing it together, as different agencies, that we can come across and referral, even to Mr. Hernandez, because of the work that he does, his line of work, and then, he's helped me a lot with some of our patients that we have in-house as well. But, right now, we're in the process of getting the, again, 31 beds back and running, so we could have them available for our community.
And congratulations, I was just in awe, because, not only does he provide these comprehensive services where, they get physical, emotional, mental, spiritual, all together. And I really enjoyed, seeing that. So I'm hoping you can get that going, but that would be the only other option that I can think of right now. And somewhere we need to get back to that idea of when we started after the detox, we had phase 2, which was residential, which we wanted to build in the area of the old juvenile probation department, where it was a recreation center, right behind where the detox is at. We wanted to build a facility. We looked at it, we went, we had the idea. This is back when Dr. Gonzalez was here. And so we had, but the thing is, where do we get the money to build it? Where, just, because there's no money to build. And then we have to fight for grant, well, we're not gonna fight with SCAN for money. Where do we get it? So there has to be a big buy-in from the community.
I was gonna mention that, other than SCAN, there's, Grace Center, but then there's also Center for, which is in Corpus Christi, even though.
Oh, yeah, we have all the out-of-town ones,
And the OSAR services are also available, so,
Sure.
But at least from my experience, when the client calls and they say they want residential treatment, and we may not have a bed available, I refer them to Center for, or I ask them to do the OSAR services, and then they screen them and they refer them and they find a residential facility in Texas, to make sure they get the help. So, it goes back to, we want to make sure that we have an integrated, approach, so that way we can help the client in the best way. And then again, like you said, we'll take it for instance, so yeah, just wanted to.
Yeah, and it has to go through the agenda so that we can start making some actions, but the discussion is there. And so, again, we'll further discuss it and probably just focus on it, because I think it's a conversation that must be had. In previous years, what we've done is we had subcommittees of these different things that needed to be addressed, maybe like that, and having to meet after this meeting to be able to just develop maybe a plan of action to bring up to either city council or our commissioners. So again, all good information. I know that everybody has something to say, because you are the ones who are experiencing it. So I think who better than you all to make these comments and be able to address them. And so to find the solution, we definitely do need to work in collaboration. So thank you all for that information. Any information, any updates?
For Laredo Public Health, quickly, with the AOT program, this is something that Frankie had mentioned. Even though we do only provide mental health services, it is a huge component, and we are court ordered, which is civil court commitment. They don't have any criminal charges or any negative connotation to it, but sometimes just the judge being involved in their treatment does serve as a great motivation for them to continue treatment. And we do treat individuals with co-occurring. One individual has been without crack cocaine for about 4 months, and we just got confirmation of another young lady 1 month without alcohol, a month and a half more or less without alcohol. And we pretty much just treat their mental health with their psych, counseling. Counseling is done weekly, psych initially is done monthly, case management 2 times a week, in person, and then the rest phone calls the other 3 days. So if it's something that we can be of benefit, and we do consider they are at the detox center, since it is also a crisis stabilization unit, they do meet the criteria for AOT as well, since it is a residential or anything like that. So just keep us in mind in case anybody that does struggle with substance use issues but does have a diagnosis of bipolar, MDD, schizophrenia, they could go ahead and go through our program, and all of our services are free. The only thing we don't cover is the medication, but we provide bus passes, we do home visits, virtual, or anything that can be of assistance.
Thank you.
For Border Region, we are taking referrals for the outpatient substance program. I do work with enrolled and non-enrolled clients, and then maybe about late April, early May, we'll be starting our youth program. But that is also for enrolled clients.
And what is that you said, the youth program?
The youth program, so it'll be from 13 to 17.
And that starts when?
Possibly late April, early May.
Thank you.
And also, I just want to mention that I passed out a flyer on all the programs that we have at SCAN. Mind you that there's some that we don't have, we do have. It's, you know, we always have some new programs and then some programs that end. But it's all from prevention to all the way from residential, as some people have mentioned already. And I just want to mention again, like Jesse had said about the wraparound. I mean, I remember back then when it started, it was something that was always done, always mentioned. And that's something that nowadays, as far as trainings, I don't hear it as much as we used to hear it before, and as we used to get together before. From prevention, intervention, treatment, all of it was there, because that's what it's called, wrap around. You know, nobody takes, you know, lead on, oh, I'm this, I'm that. It's everybody together. You know, I've been at it just like you know, more than 30 years at it. And being at SCAN, you know, I've seen when we were just one program to what is stretched out more.
Yeah.
That you say that we need beds, yes. I remember when we had so many beds that we were mostly treatment. But now, you know, we're from prevention to residential, that, yeah, it is stretched out. And unfortunately, it hurts that area of treatment that we need a lot. But yes, on the flyer, there's the programs that we have. If you have any questions on any of the programs, I believe the name of the program directors are there, the phone numbers, anything that you need, any information, feel free to call us. And I also added a flyer on spring break tips, just in case, you know, the kids nowadays, or you all, you know, just to have a safe and happy spring break week.
Thank you very much.
I just wanted to quickly invite everyone. I'm Clarissa Cabello with SCAN's outpatient youth and transitional youth services. We're having our stakeholder meeting March 26th at our main office, which is this address, 1605 Saldana, from 9 to 10. We are on this flyer, Familias Unidas. We are a SAMHSA grant that's focused on ages 12 to 17, and then transitional, which is 18 to 25, which is a lot of the age group that we're seeing right now when they grow out of the system. You know, I was with CAPS for so many years, like Border Region, but now I'm an adult and in the juvenile system, I'm growing out of it and stuff. So we invite everyone to come learn a little bit more about our program. If you don't know about it yet, it will be on the 26th from 9 to 10, or you can reach out to me so our coordinator can put you on our mailing list. We have a lot of pretty cool things going on with the youth. We have a Boy Scout group that's called Venture Crew. That's a specialized group. And it's really nice to see, you know, getting them involved with a lot of outdoor activities. Jacob just joined. They're joining in like a Pinewood Derby contest this weekend, and it's really nice. Like they built their little box cars from scratch. So there's a lot of activities that we're trying to do, and again, we focus a lot also on the transitional youth. We do a lot of family, we do a lot of wraparound. So we meet with the probation officers, with the Border Region, whoever it is that they're also receiving services from, to try to target them right now, of course, to try to prevent that escalating.
Great, thank you so much for that information. If possible, maybe for next time, would you kind of let us know how many individuals you have on a regular basis or that you have seen? I'd be interested to know how many youth are going through that program specifically.
I was gonna mention, if you don't mind, Anthony, so in the stakeholder meetings, what we do is actually provide that information, like the data, what percentage, how many clients we're seeing and things like that. And so if you guys show up, right, to the, to the stakeholder meetings, you'd be able to get that information. And in addition, we can also share it here too.
Yes, please, as a matter of fact, I was gonna say for both stakeholder meetings, or if it's the same stakeholder meeting, please send the information over to Ms. Angie so that she can forward to everybody, because I think it would be a great opportunity for other agencies to participate, because I was just specifically going to ask right now, with regards to the stakeholder meeting, we all are stakeholders, we all belong to the community, and we all have a vested interest in serving our community. And so, having to go to one of your stakeholder meetings may be benefit to another agency to hear about those numbers, or be able again to collaborate. I think we go through so many meetings all so often, and we wanna find the benefit of networking and having to provide this information. And so I think, that information, sending it over to Ms. Angie, she can forward it to everybody else to, put into our calendars.
Thank you.
Yes, I'm sorry, we forgot to mention, we're about to post on our Facebook, and social media pages that on April 3rd, we are having what's called Play Day. It is in honor of Child Abuse, Prevention Awareness Month in April. So it will be on April 3rd from 3 to 6 at the Firefighters Union Hall. Yeah, that's the Union Hall. This is I think that's like the street. But you can be on the lookout. It is free for the community. It will be. We had the pleasure. Thank you so much to the fire department and the union that helped us. It will be indoors because we know that it's really hot, and for our little ones to be outside. We've been doing it for years, but this year it will be indoor. All of our programs will be having family-friendly activities in the community, so that will be key.
At what time then?
It's from 3 to 6 on April 3rd, which is a Thursday.
Also, if there's outreach events or activities that you're all hosting that allows for other community agencies to participate, please send those out to Angie so she can pass forward. I know that Earl, and in the last meeting, we were discussing how the Drug and Alcohol Commission can get more involved and set up a booth or set up a table with the information, you know, from the collaborations of the different agencies. So if there's an opportunity for us to set up a booth, that would be greatly appreciated, but please, by all means, do let us know and send that to Ms. Angie. Thank you.
Thank you.
I just want to announce that I run the South Texas MAP program with SCAN, and we provide Suboxone treatment to individuals who have opioid use disorders. We do have availability, so if you guys want to send referrals to us, by all means, feel free to send them. We do work in collaboration with Roots, so when they get discharged, if they're on Suboxone water removal, we can continue that treatment, so that way they don't have any lasting treatment.
Yeah, I'm glad you're doing this talk, and I can let you know that we had as a committee recommended that when they got in detox, that we wanted, and everybody voted for it, that Vivitrol would be MAT available, because we want to close the pathway, the neural pathways to addiction, and Suboxone doesn't really do that as successfully as something like injectable naltrexone, Vivitrol. And so that was actually, had been voted on back like 2018, and it was part of our committee, is we're gonna set the detox, 333% of the people that come out of detox are at risk of not only relapsing, but of even dying, and so we wanna do something. And, but I'm glad that you're providing the MAT over there. I mean, I work with people who take buprenorphine, and it's just, the issue is that eventually we have to wean them off to
Right.
yeah.
To get off of it. So we work with the BOP, which is the Bureau of Prisons.
Oh, yeah.
And so they start them on the Vivitrol while they're incarcerated, and then post release from incarceration, we continue them with the Suboxone, and that's the sublingual, which is the film. And they would have to wean them out while they're incarcerated, so they can start on the film.
And we use Vivitrol in the drug court.
Oh,
It's under Monsanto, we've always used Vivitrol.
Right.
And there was one 3-year cycle where we saved the community 525,000 recidivism, going to jail, going to hospitals. I think that was a amount that I figured out, because you know, they'd be off of using heroin. You know, somebody takes Vivitrol, once it's injected, if they use an opiate, they'll go in immediate withdrawal. So plus it also knocks down the cravings, you don't have cravings. It also is FDA approved for alcohol. So I have clients that use naltrexone to do withdrawal for people that have alcohol. It's a very, very good medication, but it can be expensive, although, you know, Medicaid and all that can take care of it. I don't know what's gonna happen with that, no one does. So anyway, I like that you're doing MAT services, you know, that's good. That helps.
Thank you.
Chief. Real quick, wanted to show you the update year-to-date stats from follow-up from the last conversation from last meeting. Unfortunately, the numbers didn't show up on the downloaded version, but I'll go real quick through it. Overdose statistics for year-to-date, we've had 45 calls for service, 45 actual case reports generated out of those calls for service. We've had 4 deaths. The first one of the year was a female, age 39. The suspected substance was mixture of cocaine and fentanyl. The 3 adults that we had for the month of February, the first one's yet to have an official identification, but due to the state of the body at the time that we got called, we don't have a suspected substance yet until we get the official report. The other 2, 37 and 50. The second one, Xanax, is the suspected substance, and the last one is cocaine. For intoxication assault cases, we've only had 1 so far this year. For DWI arrest, we've had 117 and 193 drug arrests, and then you'll see the list of the case breakdown of the substances we recovered, cocaine being at the top of the list. For DWI arrest, we will be having a impaired driver campaign this week to coordinate with our spring break week and also the St. Patty's celebrations. So we'll have additional personnel. This is collaboration with Texas through grant funding that they provide funding for additional officers to be on the streets doing this specific enforcement. The last thing that I wanted to show the group is the heat map. These are 2024 overdose heat map for calls for service. And as you can see, there's a concentration in Central Laredo and South Laredo. We contrast to 2025, which is the next slide. You'll see that it's more widespread. So this is what we're seeing so far. That's pretty much it, unless there's any questions.
I have a question. Can we see that online somewhere?
We don't have it online. I know we're working with the health department and having a portal where we can have real-time statistical information.
And so right now, what can we do to get stats?
I can share with the group, especially if it's part of their efforts, something you can do if you're seeking grant funding. By all means, reach out to me, we can collaborate and help out.
If I may, we do have the RGIS map that you are
Yes.
welcome to visit. So those numbers that Chief is sharing, you can find them in the RGIS map.
Now, there might be a little bit difference because I believe the health department sees the county overall. What I present is just investigations when we get involved.
Do we have an idea of how many underage drinking incidents or individuals that you all get to see, like considering spring break or the frequency? Do we have a lot of underage drinking calls or arrests?
So we do have some, and honestly, I don't think we're tapping the surface of the problem out there because of the enforcement that it takes. A lot of these cases happen in residences where unless we have a legitimate reason or authority to go in, that we're investigating. A lot of these cases come out of noise complaints. So we have noise complaints going in the backyard, and when we go, we have minors. That's when we cite. We arrest the adults if there's one on site for furnishing or allowing for this to happen. So what I can do is I can include it in the next presentation. I can do a statistical previous years and what we've done so far. I know we've done a lot of cases out of our downtown bars. We have a lot of complaints. We're doing a lot of enforcement. So again, they take a lot of resources, but we are we suspect, not only there, but there's always places in town where we can see this happening.
Thank you.
Make a motion,
I have a
please.
question.
Yes.
What is the best route to report if we see activity like somebody dealing in the downtown area or like? Okay.
No,
With you.
obviously, we make it very easy.
Uh-huh.
We have 795-2800, we have 911, depending on the urgency of the event. Something that's happening in the moment, yeah, well, we 911 is an emergency, we'll address it. You can remain anonymous, you don't have to provide your information, just provide us the details and we will dispatch somebody. When you make yourself provide information, who you are, who's calling, that's in case we need more information as far as more details. Because sometimes the translation from the call to the way that package is sent to the officer, a lot of details are lost in translation, but
Yes.
the officer and you being willing to get contacted and not necessarily involve you in the investigation fully will allow for the officer to go and get more details, and by the time we get there, nobody's around, right? Direction of travel, those details weren't shared at the time of the call, description on people who's associated with that event, that's always helpful, but beyond the initial information on the call taking. Now, there's also Crime Stoppers. Crime Stoppers, I believe, well, no, I know it's a very good program. It might not be for every situation, right? Because some things in the moment, but when you see patterns,
Yes.
Crime Stoppers is a great vehicle to collaborate with us because they're able to provide that anonymity. They're able to provide details. There's compensation for those who reported. We've had great successes with these cases. It triggers our in-depth investigation team. So you have, depending on the situation, but any and all can be triggered.
What is the first number that you said?
795-2800 is our non-emergency. 911 is a no. Even 311 takes these complaints and they'll just send them over to us. But again, the urgency of things. Crime Stoppers, there's phone numbers, there's apps, there's all kinds of ways, and they'll connect directly to us.
Yeah, so just to mention, the Crime Stoppers tip line is 727-TIPS-8477. We do have the 24/7 tip line that is always active, and then we have the mobile application, which is completely free and anonymous. Most applications require that you either provide an email or a phone number or pay for the application. The Crime Stopper mobile application is completely free. And then you can also have dialogue with the police officer in real time as if you're texting someone. What we do is we protect the anonymity, and in some instances, if it is something that is to be investigated, we always say, refer it back to Crime Stoppers. But if it is a crime in action, then you call 911 or the 795-2800 number. But as a matter of fact, I recently just trained over at the TAG multiple units, one that includes the compliance unit. And the compliance unit is going to tackle down on certain incidents such as the bar drinking and issues. And so we've already received phone calls. It's just a matter, again, we go back to outreach and education, providing the information to the community, and someone always has that information. They just need to find an avenue on how to report it and in what way they want to report it, whether they want to collaborate with the police officers or if they want to completely remain anonymous, they can call Crime Stoppers. I stand by the program. The program has existed over 40-some years, and we continuously have success in it. So I encourage you all to let your clients know, or your family members know, your teenagers know that if there is a party going on or there's something that could potentially be reported, they can call Crime Stoppers, or again, if it's an emergency, then they call the 911 or 795-2800.
But if any of you have personal information, because I know you deal with vulnerable population, some of them are prey for these drug pushers because they know they're potential clients, somebody that's impacting your organizations, and you have personal information, call me to the side, give me information, I'll run with it.
Sure.
Thank you. All right, well, it is, I'm sorry,
I
Susan.
forget my
I know, I'm sorry. I got a call this weekend, there's, HSI, Supervisory Special Agent, Alem Surrick. He is in need of, Narcan, if anybody would like to get a hold of him. He says that, the 2 boxes that he has, they're already, no, what he has is expired, and he wants just some to give to his guys.
You can have
There's a
some.
website too where you can get free.
Okay.
But I could jump to it as soon as today.
And then we
Oh,
can do
well.
the same thing.
Okay, I have his information
Yeah,
here.
the office.
Okay, perfect. He just needs 2 boxes, so
I
if y'all can help
Yeah.
out, we're talking about collaborating, so thank you very much.
Marina,
But-
do you wanna share the information or?
Yes, his number is 915-603-9425. And, his name is ALEM, and the last name is CERKIC, so I don't know how to pronounce that. Alem Surrick, I guess, ALEM CERKIC, and his number's 915-603-9425. And he's a, HSI, Supervisory Special Agent. Thank you, I'll tell him that he's gonna give you a.
Just really quick for the Narcan specifically, he can also go to any of the 7 cabinets that we have across town. El Eden Rec Center, Marcos Aranda Rec Center, Cigarro Rec Center, Fasken Rec Center, Bruni Library, here the health department. Even Roots also has a 24-hour Narcan distribution, so.
I told him, but he didn't wanna empty him up, so.
It doesn't matter, actually, I go weekly to restock. So he can grab the 15 that are in there, or the 50, depending on the cabinet that he goes to.
Okay.
And it will be refilled the following week. So whoever needs to, please do, grab as many as you need. If you empty it out, don't worry, I'll go there and I'll fill it up again. Now, talking about Narcan and hearing how Pillar, Scan, everybody, right, Rescare has Narcan, know that at least the health department, last year, we distributed over 1,000 Narcan kits. So I know that the decrease and also how we don't see the opioids in some of the cases that we have seen here, like for example, the overdose deaths, one of them was only for fentanyl. Of course, the other one, the toxicology is still pending. But we do see that also a decrease in the fentanyl-related deaths, that it has decreased from last year to this year from 8 deaths to 4 deaths. Not only to mention that that is a GIS map, and you are all welcome to visit it. This is already has the information for 2025, that's the tab there, and you can zoom in whichever area that you specifically are looking into. And the stars are the naloxone distributions, the naloxone administration, usually done by EMS. The red crosses are the deaths, and then of course you have there the substances. Yes, you're gonna find a lot of unknown substances because at the moment that we got the data, the substance was unknown, or the toxicology report was still pending. So that's why if you go to the year 2023 and the year 2024, you see the other category or the unknown category big. But this is the reason why. But know that this map is usually updated every month through our collaboration between fire, police, planning, and Morgan.
Thank you so much. I have a question here. How many are dispensed, like in a single dispenser?
Well, the ones that are in the rec centers have 15.
15.
The one that's here, the health department has 50, and the one at Bruni Library has 50.
Okay, that's for reference, so if anybody wants to empty it out, then you have 50 or 15 to go and empty out. Thank you very much, or to reach out. Thank you all so much, I can't stress it. These meetings are very informative. They're time consuming, obviously, so we appreciate you all having to ensure that you advised us about your attendance for food purposes for next time around. We do want to make sure that you all advise us so that we can have lunch for you all. We appreciate you. We'll be meeting next month on April 9th, so please make sure that you save the date. At 12:38, I'm gonna go ahead and call the meetings that we did not formally have a quorum for, but if I could have a first and a second just for the record. I have a first by Jesse, and I have a second by Mr. Reyes. Thank you very much. We'll see you on April 9th.